Welcome to Beyond the Wax, where we have empowering conversations with remarkable women, uncovering the secrets to beauty, health, wellness, relationships, and entrepreneurship. Get ready to hear remarkable stories while eyebrows are transformed. Kellie Williams is a board-certified family nurse practitioner. Kellie focused on women's health for the majority of her nursing career with a subspecialty in gynecology oncology at Advent Health and Orlando Health over a period of 10 years. Her passion for women's health has allowed her to develop relationships while providing professional and compassionate care. Help me welcome Kellie Williams. Kellie Williams, welcome to Beyond the Wax. I'm so excited to have you here.
I am so excited to be here with you, Marjorie.
We're going to do your brows, and you've been here before, so we're going to just zhuzh them up and talk all things, I wanted to say all things vagina. All things women care, body care, vaginas, PCOS, weight, aging, all of it.
Yes.
Now, I wanted to start off by asking you, how did you get into the medical world? What made you choose women's health, and specifically, tell me about what you do and who you are and how you got into this.
So I started at Advent Health. So I started 14 years ago in nursing. And
that's a long time.
landed in gynecology oncology. And that oncology part is all the cancers below the waist, uterine, vulvar, vaginal, cervical cancer. So I did that for about 10 years. And I always knew that I connected with women in the healthcare field.
Was this while you were doing like your nursing program?
Actually, I started off as a registered nurse.
Okay.
So registered nurse, because that's what you start off before you go into nurse practitioner. So I did that for 14 years. And then I said, you know what? I actually want to take care of women on how I think they should be taken care of. Well, I
like on a more personal level.
Exactly. On a more personal
What was
level.
that point that made you really be like, it's been 14 years, I'm going to do something different? Because like I feel like a lot of people can get really comfortable in what they do, especially after so long. Mm-hmm. Where was the turning point for you?
So the turning point was so I connected with all of my patients.
I love that.
That's what I did. I knew I had that down. What I didn't like is working for a hospital system that required me to do things that I didn't want to do. So that's kind of where the turning point was for me. So again, you have to look at it like this. Patients come in, again, it's insurance based. So the number of patients that you would have to see in a day is it's crazy.
It's a big thing out there.
Huge.
Yeah, it's a big
huge.
thing. Even now, like for me, these doctor's appointments are so long, and you get seen for 2 seconds. And I can't even tell you the amount of times that I have had clients of mine complain that the technician, the doctor or, whoever walks into the room, doesn't introduce themselves.
Exactly.
And it's like, okay, you're good to
Bye.
go.
Yeah. So just imagine, so I'm that healthcare provider while I'm seeing patients every 15 minutes.
Yeah.
And again, we're speaking of women's health. So women, they come in and they have a list of things. Because again, you have to remember, I'm seeing women every year. Do you know how many things can happen in a year? So I see them and we have this 15-minute slot for them to get all of their concerns and healthcare issues addressed in that 15-minute slot.
Do you feel like it's a little bit desensitized? Kind of like another big topic, of course, is childbirth and how, they're just so used to doing this back to back to back.
Robot, like a robot, yes. So I don't like that, never did. And again, I was getting the same thing as I was going in for my wellness check. So I said, you know what? I am going to start my own women's health clinic.
That's amazing.
And I am going to do it how I want on my time and not have these 15-minute visits for each client because you just can't get enough done for them.
You sound
in
like
15
me.
minutes.
I love that.
So I said, all right, I'm done with, working for another practice and making them so much money. And I said, I'm just going to go out and do it on my own.
And also making it more accessible.
Making it more accessible. Now, again, although I don't take insurance, because again, if I start taking insurance, I would have to go back to that every 15-minute slot to be able to run a business, right? So I'm going to make it affordable, accessible. You have all the time you need to get all of your issues addressed. And I don't think a lot of women realize there's so many different resources if you didn't have insurance that, me as a healthcare provider could tap into and get the health care that you need.
And you're really good about that too. I feel like you, with your clients, you're very thorough and you get that like very personalized conversation to where you're like, well, here, I have this and this and this option for you.
Yes.
Do what works best for you.
Yes, and that is so important. All of the tools right there to give to each patient for whatever it is that they need. Can you imagine doing that in 15 minutes? You can't. You don't have the time.
That's exactly why. I mean, obviously not related, but related. I don't do brows in 15 minutes.
You can't.
I don't want to charge you, whatever dollars to do your brows in 15 minutes. You're paying the same price that you will getting your brows done in 15 minutes, but you get the time that you deserve. No anxiety.
Yes.
This is your me time. Now, I will say there's a lot of estheticians out there that pride themselves on these quick services and they do promote it as that. And I think it's amazing. There's a target audience for that. I can mold myself to, if you're in a rush, I got you. And I'm sure it's the same for you.
Oh, for sure.
But for the most part, in that 30 minutes, I will not be squeezing into clients.
No.
You get the time that you
get your time,
I love that.
Yeah, and that is a part of the value that you provide to each client.
Yeah.
Because they feel like you took the time just to care for whatever it is they need in that time frame. There was nothing rushed about it, and they got what they needed. So that is what has led me to my practice and why I love it so much. And I wouldn't do anything different.
And congrats to you for achieving that and being where you are today. It's a huge accomplishment. Now, I want to know what services do you offer? Because it's targeted towards women. So we have a lot of stuff going on.
Oh, yeah.
So what services do you offer?
So if you think of it, anything a woman could need.
That's what I'm saying. That's a lot of services.
All right, let me nail it down. So first and foremost, I offer gynecological services. And when you say what is that, that includes your yearly pap smear, a pelvic exam. And that is something that I do a lot of education with women on getting their well woman exam, which includes a breast exam, a pap smear, and a pelvic exam yearly.
Okay.
So I do that. I offer hormone therapy, wellness. We do weight loss therapy. I offer PCOS consultations, and I treat patients with PCOS. I just started doing infertility consultations because that is definitely on the rise.
Yeah.
And that kind of sometimes ties into PCOS, sometimes not. And so I insert IUDs. I don't know if you are familiar
yes.
with
It's a form of contraceptive, correct?
Yes, it is a form of contraception, yes. So I insert IUDs. There's another device. I do all birth control
removal
consultations.
too?
Yes, removal, insertion, all of the above. The only thing I don't do is OB and babies.
Okay.
So I always like to clear that up. So I'm gynecology only, and then I add additional wellness services for women.
That's amazing. I just to touch on that, because the fact that you were able to start your own business, I feel like it's not talked about often. The fact that not being this certain title and being able to branch out on your own. So can you talk about when was the moment that you realized that you could do this and what credentials really you need in order to be able to do this? As far as I'm sure it's so wide. You know what I mean? But how was that for you? Because that realization must have been kind of amazing.
It was.
Right?
It was. So I am, just to kind of start off with who I am. So I am a nurse practitioner. And what that means is I am licensed to treat, diagnose, write orders for patients. Okay, so you have that in and of itself.
Yeah.
And what has happened in the last 4 years, we were always required to work under a medical doctor or a physician. So 4 years ago...
I feel, sorry to interrupt you, but I feel like
good.
nowadays you don't even get to see the actual doctor.
Correct.
Nurse practitioners are the ones handling our charts.
Correct.
Doing all the work.
Yes.
And really taking care of us.
Correct. So what happened, I want to say in 2021, Ron DeSantis put in place an order where nurse practitioners in the state of Florida could practice individually without a medical doctor in the primary care service sector. So
what year?
This is 2021.
2021.
Yeah, 2021. And once I found that out, now, granted, I was already starting to form the business plan of what I wanted to do.
You were scheming.
Oh,
You were ready.
Yeah. Oh, yeah, I was ready.
Good.
And I know quite a few physicians here in Orlando. So if I needed a medical doctor to kind of oversee what I was doing, that would have been fine. However, I think I jumped really fast.
Too fast?
Too fast in 2022 and branched out and started my own practice.
Okay. How was that?
Fun.
I love that perspective. Fun.
And when I say fun, I want to say it was challenging. I learned a lot. So you make mistakes. And when I say mistakes, you're really just learning when I talk about mistakes. So it was, okay, what can I do, what I cannot do? And then you have to remember I was leaving a practice.
Would you say more mistakes as far as like running the business?
Yes.
Okay.
So just running the business in terms of how did I want to market? What is it that I'm really trying to give women? So I initially started off with, I should do like a subscription.
Okay.
And do like
you
a
gotta
monthly,
try it all, you know?
Just let's do a monthly membership and let's, charge X amount of dollars and patients, women can see me how often
as much as they want.
As much as they want.
Oh, of course, because Kellie,
yeah. They were like,
oh my God.
You know what? I thought that's what women wanted, but let me tell you something, Marjorie, and you would probably know this. Your clients will tell you exactly what they need from you and what they want. So
I'm always like, text me if you need anything.
Yeah.
Don't hear from them.
Right. But they also tell you kind of what it is that they need from your business, right? Yeah. So monthly subscriptions, that was not it. They were like, I just want to come and go as I want. And I'm like, okay. So I had to like tweak the business model and turn that into like, okay, it's going to be per visit, self-pay, which works. That works really well.
Well, it's just less messy insurance-wise.
It is.
I have a few friends that are in this space in all aspects of medical, and just to even submit, get that process going, get approved, it's a whole thing.
It is, but you have to really like narrow down what it is that you're trying to do. So you have to say, for me, it was because it was primary care that I was providing for women. I had to go get a business license. Okay, well, you got to get two because you got to get where you're currently in the city that you're practicing, and then you have to go to the Department of Health. So those are two things you have to kind of get ahead of yourself. Then you got to find the building. So that, I think that was the most challenging part. Because again, I wanted to try to test this out. I didn't want to be
locked into like a 3-year lease.
Heck no.
Yeah. Trust me.
I know.
I've been there.
That's not how I wanted to start. I wanted someone to say, hey, we'll give you a 1-year lease. If this works, it works. If it doesn't, it doesn't. And so I would like to say June of this year would be 2 years in. So it's working.
Amazing.
Yes,
and
it's
which
working.
we'll touch on. I know you've got some really exciting things happening soon, but that's amazing. Good for you.
Yes. Yeah.
Perfect. So good. Now, tell me, I know you say you offer a few different things, and I do want to go over all of them, but I feel like such a big topic is PCOS. What is PCOS?
So PCOS, and I'm just going to kind of spell that out for those who don't know. It stands for polycystic ovarian syndrome. And PCOS has been around for many, 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 many years. Yeah. Now we're getting more information on what this truly is and what it looks like and how we as healthcare providers have to diagnose it, right? So PCOS, how I look at it is, at first when I learned about PCOS, I was telling my patients, it's basically kind of what it says, polycystic ovarian syndrome, meaning some patients could have multiple cysts on their ovaries, right? That's where the polycystic ovarian part came in. So initially, that's usually how most providers were diagnosing PCOS. They would do an ultrasound and say, oh, yeah, you have multiple follicles on your ovaries, you have PCOS.
Keyword initially.
Yeah, initially. No, it's changed over time, right?
I'm traumatized.
So now you have to really look, because in the beginning, I'm going to be honest, Marjorie, usually PCOS patients, I could look at them and know immediately they had PCOS. And you want me to tell you what I was looking at? They were obese. They did not have a period for 3 to 6 months. And those are the two things that I would look at coming in when patients would come in to see me. But you had to kind of dig a little further with some of these patients. And you had to do something that I do with my patients. You check hormone levels. Okay.
So, yes, check hormone levels. I want to know a little bit more. Break it down for me a little bit more, because I feel like no one really knows what PCOS is now. And unfortunately, even some service providers, doctors and whatnot will be like, oh, this is what you have. And
but they won't go and tell you what is causing that. Yes.
So it's confusing and misleading, and it's hard because our bodies are so complex. How does a doctor or nurse practitioner, someone in medicine, know that it's PCOS nowadays?
So they have this Rotterdam criteria, and I'm not sure if you're familiar with it.
So I have PCOS, and we'll dive into that a little deeper later. But I got a few tests before I got properly diagnosed. A lot of times it was, no, you don't have that. But then I know that it goes also by levels, like it could be spiked and whatnot. So I think I got different answers as I went on, but most of it involved ultrasounds and obviously getting a culture from inside done. Like a internal ultrasound.
Okay, so you had you had a transvaginal ultrasound, and that's really to look at your ovaries.
Yes.
Now, some clients will not, or some patients may not have multiple cysts on their ovaries. Okay, so you can't just go by that diagnosis. So what we usually do is we go with, there's several symptoms, right? So you can have weight gain, irregular periods, testosterone levels elevated, which is high levels of androgen in the body, insulin resistance. I don't know if you're familiar with the insulin resistant part.
Yeah. So I had hirsutism.
Yep. Yes.
Wait, did I say that right?
Yeah, hirsutism.
Hirsutism. High testosterone levels, high insulin levels.
Okay.
The only thing that I had going for me was that I had regular periods.
Okay.
But
and somebody probably said, okay, you have regular periods, so you're fine.
And that's exactly what happened.
So you can't go by, like I said, initially that was something that we went by. Irregular periods, and you have multiple ovarian follicles on your ovaries, right? You can't go by that any longer. What we did is we went deeper to find out what could be the actual culprit of it, and what we tapped into is elevated testosterone and insulin resistance. Those are the two key parts, and that's done with a lab. So that's why
it shows more medically.
Exactly.
Yeah.
Because if you don't tap into those two, you're not really treating the PCOS. So again, once you go through all of the symptoms that you present, you can basically say, okay, you do have PCOS, and then there's so many ways to treat PCOS. Now, you'll get some providers, they'll hand you a birth control pill because that's what they I know it's going to make you crazy, girl. I know. It makes me crazy. They'll hand you birth control pills because remember I told you they're going by irregular periods.
Yeah.
So they're going by, okay, let's treat their irregular period with the birth control pills and bye-bye, see you later. Hope you do well.
But that's what kills me. It's like, obviously, I'm not a doctor. I don't know these things. And I do browse for a living, and here I am hosting a podcast, okay? My whole thing is, if I make something that's supposed to be a one-size-fit-all, and we're so different, such complex human beings.
So complex.
How are we supposed to suppress certain things, certain diagnostics, and with one single pill?
You can't. You gotta really touch it deeper than that. You have to really go deeper than the birth control.
It wasn't tailored to me.
No.
Nobody sat in a lab and made it for me.
No.
So I think the people that I worked for, amazing. You were one of the whatever amount that it worked out for. But for those of us that I feel like when I came off birth control, I felt crazy.
Yeah, I don't like giving birth. That is one thing, and I know some providers are going to be like, well, that's what we do. We've been doing it for years.
Yeah.
No. I was on birth control pill, and I'm just going to say I was a bitch. I'm just going to say
Thank you. Me too. I was a crazy person.
Yeah, get me off of this stuff now.
I never felt more like myself when I got off of it. I've been off birth control for 6 years now. I know that it's hard for some women. Maybe you don't want to get pregnant. I promise you there's so many other ways.
There are so many other ways. And you have to think about some women, well, they were started when they were teenagers, right?
That's such a crazy thing.
Yeah. They start at 14 and that's all they know. So they've been on birth control pills. Just think about it. They're now in their 30s and they're still taking birth control pills from when they were 15. Yeah. So you truly don't know how your body responds without that synthetic hormone that's basically taking over your body anyway. So yeah, no, not a fan of birth control pills.
Okay, so what would you say would be something to look for when getting blood work as far as knowing if you have PCOS or not? Because I feel like a lot of women are very unsure. Nobody gets a clear answer. I know I had to go through a few exams just to find out if this was what I had. Mm-hmm. What would you suggest to anyone listening that is wondering if they have thyroid, which is that whole other thing?
Yes.
Thyroid, what is it called? Thyroidism or
hypothyroidism?
Or
yes,
PCOS.
Or PCOS. Mm-hmm. So I would say you definitely want to have your provider order a thyroid panel first. Okay. Thyroid panel should be a part of your lab. Another one is testosterone. Now there's free and total. The provider will know to order both of those to look at your levels. And then there's another one, most important is insulin. Now you'll have some physicians that'll do like a hemoglobin A1C. You probably have heard that before for your diabetic patients. That's not what I'm speaking of. I'm speaking of the actual insulin. This is how much your body makes insulin and how you respond to it. You want to know if that level is high. I would probably say out of all of my PCOS patients, 80% of them always come back with elevated testosterone and elevated insulin.
Wow. Can you discuss a little bit about what challenges someone with PCOS might face as far as like weight loss goes?
Oh my God. It's because PCOS is so complex, and then you're going to add obesity, which is complex. So we've already named obesity as a chronic disease, right? Mm-hmm. So you add both of those, which they're both chronic. I would probably say the most difficult part is getting their weight. Oh my God, that is so difficult with some of the PCOS patients that I have.
Because it feels like you try and nothing just happens. It's almost like your body just doesn't respond to what you're trying to do.
But then you have to really tap into what is it that you're trying to do. Your body may not say, that's not really how we're losing weight with this body. You're going to need something else to kind of help you with this, right?
That makes sense.
So that's why I kind of, and then that's why I implement weight loss therapy. Weight loss therapy is huge now. I know you've heard everybody talking about weight loss therapy, and
we're gonna get into it.
Oh yes,
I definitely want to. This is why she's here.
Oh, I can't wait.
I'm giving.
Oh, I know you're giving. I know what you do, Marjorie. You already show.
You're so sweet. If a diet doesn't show you how different we are,
I'm telling you, that's why everybody should really tap into what works for them in terms of losing weight or becoming healthy. You have to really tap into that. You can't like do what Susie's doing over there because that worked for her. That's going to work for me. Mm-mm.
I agree. We're done.
Ooh.
Are you ready?
Can't wait. Yes, girl.
Yeah, girlfriend. And I kept them
I already know you slayed. I already know.
Stop. I kept them really natural. I'm gonna hand you the mirror so that you can take a look.
Thank you.
There better be tears. I'm just kidding.
There better be tears. You're so
No, but
cute.
part of the brow is gonna look a little bit darker, just because the tint looks different from the permanent makeup, since you do have permanent makeup that has faded quite a bit. But I didn't put any tint on the areas that you do have permanent makeup that are really dark.
Okay.
So, however, the shades of
kinda
darkness
blended.
look different a little bit, you know?
Okay.
But yes, kind of
Okay.
blend. Here you go. You can bring
You
that up
got
to
me
your
ready
face.
for Easter. Oh, look
Oh,
at that.
yay.
Nice.
Good, right?
Yes.
Nothing too crazy.
Ooh, Marjorie over here slaying brows, y'all.
It's what I do. It's
love
what I
it.
live for. All right, we're gonna go ahead and sit you up.
Okay.
And then we'll continue our conversation.
All right. Lovely.
good. I tried to do them as natural as I could.
So pretty. Oh, so pretty.
Stop. I love it.
I needed that. I needed
Yeah.
this to sit here and talk to you. So with the brow slayed, it's just everybody's gonna be looking at the brow.
Well, you said Easter's coming up, so you'll be ready for
Easter's
that.
coming up. I'm Easter ready.
I love that. Let's move back into PCOS and weight loss. I want to know, since you work with women that have this condition, how do you approach the psychological aspects of weight loss with your patients, especially considering like the emotional toll that PCOS takes on someone?
So I usually try to figure out what they're struggling with if we're talking about just obesity and weight, right? And once again, I have PCOS patients that'll come and say, I don't eat a lot. I don't know why I'm this heavy. You know, when I was in my 20s, I was, I was this weight. And in the last 5 years, I became this way. And I try to tap into, one, it's not their fault. Two, that is more of, again, I like to say internal DNA base, where a healthcare provider will have to tap into that. So again, it's not just based on what they're eating or how they're eating, right? Let's just say they eat 1 meal a day. They're still going to probably gain 10 to 20 pounds, right? So we really have to kind of customize it to what works for them. That is why, and I'm going to just kind of jump into weight loss drugs that are now on the market now. I know you're familiar with them.
Yes.
Semaglutide, which is Ozempic. You have Wegovy, which is that's another medication for weight loss. Now, Ozempic is for diabetic patients, and then you have Wegovy, that's for patients who are trying to lose weight. I will tap into those for sure.
As far as and I definitely want to dive into that a little bit deeper. As far as though emotionally, even providing this, has there been women who emotionally really struggle with this? As far as where it melts into other aspects of their life and they're just literally depressed from it?
Yes, there is. And this is the part that I get. It's I've been misdiagnosed for so many years. And again, treating PCOS is kind of like a time thing. It's kind of like you got to jump on it to get ahead of it, or it's just out of control. Emotionally, yes. So PCOS, it comes with, so some of my patients have fertility issues with PCOS.
Yeah.
Just the image of them where they're one weight in their 20s, and now in a span of 5 years, they're this way. So emotionally, that will take a toll on just how they feel. They're tired. They're dealing with acne here, really bad acne.
Such a big thing.
So that is,
especially if they're on birth control.
Exactly.
Now, going back to the medication, like I can imagine you know, sitting there with them and being like, okay, you've exhausted all your other options. Mm-hmm. You're clearly not getting the help that you need. Here's another option that I can provide for you. Now, this is a really controversial topic.
What?
So, I mean, you know it is. What? Like the whole medication semaglutide, Wegovy, Mounjaro.
Yes.
Okay, what is semaglutide? Tell me. And what is Mounjaro? What is Wegovy? How are they the same? How are they different? And what do they do?
Okay. So semaglutide is a GLP-1. So that's glucagon-like peptide that we already have in our body. Okay. Now, this is the thing. Some individuals...
Write this down, people.
Yes, write this down. GLP-1 in somebody's body may actually work like it should. And that's really the peptide that's telling your brain we need to eat more. It's that food noise.
Is this what we would consider the metabolism?
Kind of the metabolism, but it's more of... So I know for me and my girlfriends, they get really crazy with me and upset. I can eat any and everything.
You're one of those.
I know. But let me tell you. I know. But let me tell you. Everybody's not like me. They're not made where they can eat any and everything and not lose any weight. So that peptide, thank you, peptide gods, it's helping my brain and gut to talk and say, it really calms down that food noise is what it's doing. So think about some patients, they don't have that glucagon-like peptide that's working for them, right? It's, like I said, we go back to a patient that's eating 1 meal a day.
Right.
But in her mind, she really wants to eat more, right? But you get you get what I'm saying? So that is what semaglutide connects with in the body. It actually has the brain and gut conversation, and it calms down that food noise. It also helps with the gut to make you feel full longer. That's what... So
it sends signals, basically.
Exactly.
Okay.
Exactly.
And so what is the difference of the medications out there? Or like...
Difference?
Yeah.
So you have Ozempic, which was marketed for patients with diabetes.
Okay.
And then you have Wegovy, which is same concept, same ingredient, which was marketed for patients in weight loss.
So they just basically grabbed the same medication and said, let's market it different so that it targets a different audience.
Exactly.
But basically it's the same thing.
It's the same thing.
I'm wondering, are they also price different?
They are price different.
Wow.
Know, pharmaceutical companies are going to get their money. Hello.
Love that for us.
So, I know. But so I'm trying to like make this make sense because right.
Because it is confusing, which is, why we're talking about it. Like I wanted to bring some awareness to this. My goal truly is to normalize this a little bit because I feel like we're not talking about it.
Why?
Women aren't talking about it.
Why are they not talking about it?
I think I have, how do I say this? Because now I'm also like, as far as like my clients and stuff.
Yes.
There's people that are on it and that they don't feel comfortable talking about it because I think that they feel like their hard work isn't going to be validated. So can you clear that up a little bit?
Okay. So that is so far from the truth. When we
as
say
in like that magic pill, like I took this and I'm no longer like it doesn't make you lose weight.
Well, no, because we're not. So think about it. So for Susie, she can eat the right diet and work out, and she's fine, right? That's for Susie. Now, I want to go back and say the injections are not this magic pill. When I educate my
time,
patient,
I didn't hear you. This isn't
the injections alone is not the magic pill.
Okay.
So you have to change your diet. It's almost like the patients who are on the injections are working a little bit harder than those who are just working out and eating a right diet.
Because you're fighting something that wasn't given to you naturally.
It's DNA based. You're fighting something that it doesn't matter how, and you've heard it all. I've done this, I lose weight, I gain weight, I lose weight, I gain weight. And that's because you have that peptide that is corrupted somehow, and that's where the injection comes in and helps with diet, right, and exercise and just lifestyle changes. So you actually need 3 of those things to be able to get to where you're wanting to get to, because just 2 of those wouldn't help you. It won't work. Exactly.
So what you're saying is someone who is taking this medication still has to put in the work.
Absolutely. So when I take care of my clients, I always tell them beginning, so listen, I think you're a candidate for the injection. However, you're going to still have to change what you eat, and you're still going to have to move. Simple as that.
Right.
And I ask, if you're able to do those 3 things, you're going to lose the weight. Period. The end.
Do you notice that? Because on my end, obviously, I do notice it. Do you notice it on your end that people don't want to talk about it?
I do. I will probably say about 80% of my clients don't want anyone to know that they're doing the injections.
That's crazy.
And I really try to ask, I'm really trying to tap into what is the reason. And kind of what you just said, they feel like, they didn't put in the work. Heck yeah, you put in the work. You actually had to double your work to do it, right? Because again, 5 years ago, you were eating correctly and you were working out, and the numbers didn't change. You still felt
it's almost like you're fighting against it.
Exactly. So we probably need to nip that in the bud. It doesn't make sense to me why we're trying to shame. That's kind of what it is. It's to shame someone because they're using the injections to help them become healthier is what I don't understand what the shame is about.
Talk to me a little bit about the side effects of taking this, and how long does one have to be on? Is it forever?
This is a good question.
Is it temporarily?
So I'm going to jump into side effects. So some of the main side effects is constipation, and then you have to remember it's working on the gut. It's slowing down your digestive system, so your body's just not moving like it should. Nausea, because you have that gut-brain mechanism there, which is going to cause a little bit of the nausea. I will have some of my patients have fatigue when they first start. And again, it's a new medication. It's trying to
your body's getting used to it.
Exactly. Your body's trying to adapt to it. So those 3 are the most common. Okay. Now you'll hear patients say, "Oh, you're on that and you're going to lose your muscle mass." No, because again, we got to work out.
You're
Remember?
Still working out. You still got to eat healthy.
So that's always going to combat that. Oh, you're losing your muscle mass. You're losing weight too fast. The injections don't cause you to lose weight fast, like the magic pill that you spoke of, which I don't even know what that is.
Well, I mean, I feel like back in the day, I've done every diet under the sun, girl. And I feel like there has been pills that are
very temporary,
right? That suppress your hunger. Just recently, I actually had a friend who was on this medication and lost her insurance, and so she jumped on another medication that her insurance covered it and made her so sick. It was like an old one. Yeah. I can't remember the name.
Was it an injection?
No, a pill.
Phentermine? I mean, phentermine's been around.
That sounds familiar.
Yeah, phentermine's been around.
But, it's like this magic pill that we're all like chasing kind of, and I think that people think that this is going to be something that is going to be quick, and not only that it's shameful to talk about because they don't want people to think that they didn't put in the work. It's almost like the surgery subject.
No.
Like, oh, you got surgery, you didn't go to the gym. You know, you know what I mean?
So we got to go back to obesity is a chronic disease. It's almost like high blood pressure. That's a chronic disease. Some can eat well and not be on a blood pressure medication. Obesity is a chronic disease. Now, to go back to your question, and I actually just found this, I knew this, but I didn't really believe it when you ask how long a patient should be or expect to be on the injection.
Right.
So I don't know, Oprah Winfrey had a special on Hulu.
Oh, okay. No, I haven't seen it.
Yes, it aired last Monday.
Okay, so recent.
On Hulu,
I've got to catch it.
Oprah Winfrey's on the injections, and she talked about
she's open about it.
And she's very open about it because she wanted to really get over the shaming of it. So she had
beautiful. I need to
obesity.
check that out.
Yeah, she had physicians on there who specialize in obesity, and she asked that one question: how long? And the physician specifically said, these are lifetime injections, which you have to think about how your body works, though. The minute you come off, it's going to go back to what it knows. And that's why I have a lot of my clients, they get off and they do maintenance, and then they have to get back on. Because, again, it's more internal.
I've read of a few people who have gotten off and kept the weight off.
Okay. Those are my girls, right?
Okay. That's the goal.
That's the goal. Those are my girls, and that's what you really, really
right.
want. But there is a small percentage of those patients who may have to be on it for a while.
For life.
For life.
Yeah.
Unfortunately.
That's interesting.
But again, it goes back to what is going on with their body, that if that medication is taken away, they're going to go back to that peptide that's not working.
But it's almost like this is so, it's looked so like it's so frowned upon, but yet we're okay with taking birth control for 20 years.
You see that? Make it make sense?
Every day.
But think about, why is this looked up on when
Isn't this weekly?
What, the injections? Yeah, they're weekly. But why is this looked up on when it improves your blood pressure and improves your cholesterol? You're losing the weight. Yeah. Your sugar levels are down. So why is that looked up on if you want to become your healthiest self?
Yeah.
Again, I think if there's not enough education, you're just going to have ignorance that's spewed out about it.
Now, as far as that goes, on a more global level, I know you've seen some of the things going on in media in regards to not only, I guess, hate in the regard of using it and it being cheating, but in regards to, oh, if you don't have insulin, why are you taking your medication away from us? Have you heard of that?
No. But
so
what
people
are we
who are actually diabetic were upset because people with PCOS were consuming this medication. The insurance was covering it, and they were like, we don't have enough of it because everybody wanted to get on this.
You know how I looked at that? I looked at the people who were getting it who had PCOS. They were actually being proactive because we all know PCOS can lead to diabetes.
Yes.
So those patients were being
I was pre-diabetic at one point.
Exactly.
Yeah.
So that's kind of what I am confused on. If I am trying to get ahead of my health, I'm not taking it away from patients who are diabetics. The pharmaceutical company is going to make more of it. Just hold tight. It's coming. Listen,
I'm going to quote this.
Listen. We're not taking a medication away from diabetics. There is another. Did you hear me say there's Ozempic for patients who have diabetes? And then there's Wegovy, right?
What other brands out there? Because there's... are both semaglutide?
Yes, semaglutide. Okay. And then you have compounding pharmacies. They said, there's a shortage. We'll make the ingredient semaglutide, and you can also offer that as well. So the taken away from, I have diabetes and you're taking this medication away from me? No.
Not a thing.
Not a thing. No, not at all.
It's not a thing in the medical world, people. You heard it here first. Wow.
No, it's not.
Yeah.
Patients are literally saying, hey, if this can help me lose weight, I've been trying for 20 years. Oprah said it herself. You guys know she's been up and down, up and down, up and down.
Is she still promoting Weight Watchers?
Up and down.
No.
She got off the board with Weight Watchers so that she can talk more about the
Good for
Ozempic
her.
and semaglutide.
I'm gonna check that out.
Mm-hmm. It was very informational. It was great. You had the physicians, you had several ladies on there who talked about it, and I am.
That's why I wanted you here,
yes.
because I think this needs to be talked about in general. You
know, in general,
yeah.
And for those who are still questioning it and concerned, and are like, oh, you got this magic pill. No, you should sit down and talk with a healthcare provider and really find out how this is improving lives.
100%.
100%.
100%. I recently read, actually not recently, a while ago, read that they're going to market this medication for people who have alcoholism.
Yes.
I think that is just
that is going to be brilliant.
So it's true.
It is true. And so this is a funny story. So last year, I started to talk about it with my clients and prescribe with my patients about a year ago. Mm-hmm. And I want to say about 5 of my ladies had started it. Now, they were cocktail drinkers, and they would have a glass of wine every night. And they all noticed the same thing, which was interesting. They all told me after starting the injections, they realized that they didn't have that taste for a cocktail or
that's so bizarre.
A glass of wine, or they were pouring their wine down the sink. She's like, who's wasting alcohol around here?
Not down the sink.
So when she told me that, I went to go do some research and digging, and I did find that they are doing studies and research on this.
That's going to be a game changer. Like, game changer.
And I was going to be interested to see who looks down upon that.
That's what I was saying. That's exactly what I was just thinking about, because this is a huge problem.
Huge. And we've always tried to combat alcoholism, and we're just kind of like, ooh.
I know. I didn't think of it. The more I leaned into my sober lifestyle, I'm going to be a year sober next month.
Wow.
Isn't that insane?
That is insane. Love it.
Thank you.
Congratulations for you.
Thank you so much. And, I don't have an addictive personality with anything. Mm-hmm. I almost was like toning that down in the sense of like, this isn't a big deal. Mm-hmm. Like, it's not a big deal.
It's not a big deal.
But because I put so much effort into it not being a big deal when I'm out, Mm-hmm. And so now I'm like, dang, like I should be really proud of myself. There's so many people that struggle with this on a deeper level.
Chronic disease again.
Yeah.
It's a chronic disease. Mm-hmm.
And, and people who go through facilities and detoxes. Mm-hmm. And I'm just like, this would be amazing.
Yeah, it's going to be a game changer.
Yeah.
Because I want to say in the last 30 years, they've been trying to tap into how to help with alcoholism, because again, it's been labeled as a chronic disease as well.
What other ways have you found that this can help?
And it is indicated for use of that as well. Wow. So I've seen their numbers go from the 200s down into the 100s in almost a 3-month span with the injections. Is
there an age range that this is like targeted for? Or, I mean, I guess if you're saying that it's lifetime, I guess it doesn't matter.
So I usually treat patients 18 and above because they don't have enough research for your adolescents, which I think they should. I think that's coming on the rise as well, because that's kind of where it starts. Mm-hmm. If they can tap into that, it kind of beats the adult part of obesity for them.
Again, I'm not qualified to even speak on this, but I feel like when we were bigger, when we were little, we kind of grow out of that. Mm-hmm, mm-hmm. But 18 is like a good
18 is where your body, your metabolism's where it should be, and you'll kind of know the college years right. No, for sure.
Can you share some success stories or strategies from your practice that you have helped patients with PCOS and their weight loss goals?
Yes. So I'm so excited about this. So I have been taking care of a PCOS patient for about a year.
Okay.
A full year. Oh my God, I wish she could be here to tell this story. When I started with her, she was 280.
Oh, wow. Okay.
280. Had tried every single thing. Desperate.
I feel it. Like, I feel it. I've been there. I feel that desperation.
Misdiagnosed so many times. So she comes to me like nearly in tears at this point, right?
How did she hear of you?
So she heard of me from one of my patients that live in the community.
Okay.
So I treated her friend has PCOS. So that's kind of how the PCOS kind of circled around.
The PCOS girlies.
Listen, PCOS.
Don't gatekeep.
Yeah, I know.
Unite.
You know what? I think it's out now.
Listen.
PCOS is out there.
Yeah.
Nobody's holding that.
Yeah.
It's like, wait, you have that? I have that too.
Yeah, oh my God.
Go see her. She'll be able to sit down and talk to you.
My clients know. I be giving them your info.
So and she was on birth control. That was a thing, but she was just gaining weight. Periods were still crazy though. Yeah. Just a mess. Mood wise, she was a mess. So I said, okay, so listen, we're going to take you off these birth control pills. She's like, okay, that's fine. Take them off. Take it away. And we're going to start doing natural supplements. Okay. And then I'm going to slowly introduce to you the weight loss injection. Okay.
Okay.
Because she was one of those that was like not sure of it, didn't know a lot about it, and didn't know if it could help her. But I sat in that office for an hour and a half, and I educated her, and I explained how it could help. So this is like a year ago I meet this girl, right? So, oh my God, she just needs to tell this story. Aww. So in a year, okay, she's lost 80, do you hear me? 80 pounds in a full year, right? Which is great. Amazing, because she couldn't do it however she was doing it before. Not only that, her periods are regular. And this is the killer, because she always wanted to have a baby.
Is she pregnant?
She is pregnant with her first child. I know, look at that. It's like, oh my God, it gives me chills every time I think about it.
I'm such a marshmallow. I get emotional.
She calls me and she says, Kellie, you won't believe this. Amazing. She will now, again, she dropped her 80 pounds, maintaining like she should, eating well, and she's pregnant with her first baby. Now, again.
Wait, but I have questions.
Yes.
I have questions.
Yes.
Can someone who is pregnant be on the medication?
No.
Do you want some water?
No, I'm good. I'm good. So no, she stopped. Okay. I want to say she stopped like 6 months.
You can't be on it. Why?
No, because it is not studied, right? Those injections are not studied for pregnancy and not even trying. So luckily for her, she had stopped 6 months before even thinking about it. Mm-hmm.
And so I guess that was going to be my next question, but you just answered
trying to conceive?
Right.
Yes.
Does it help or does it prevent or do we not know?
I think it does both.
Oh boy. Okay.
No,
depending on the body.
But you gotta think of it this way. So think about you're becoming your healthiest, right? Your weight's coming down because 280. Who's
right? No, I'm thinking of it in the sense of like if you're like not trying to be on birth control, but you're trying to lose the weight.
You have that gray area.
You know what I mean?
You do have that gray area there. It's like I have quite a few of my patients who are like, okay, Kellie, I'm kind of down where I need to be and I want to try and start to conceive. And I wean them off and say, hey, we got to get off of this to kind of give your body a good reset and then you go and try to conceive.
So can it also work as a contraceptive or it depends on every person?
It depends on individual.
How it's going to react. Gotcha.
Everybody's individual. It's not a contraceptive. No.
Okay.
So can you get pregnant with the injections? Possibly. Absolutely.
Okay.
Now, what is happening there? We got to figure that part out. We just know when you do, you stop immediately. Because we don't have enough data to show that it is.
Is it being studied?
In pregnancy. I think they are studying that. Yes, they are.
Because that has to.
No, it's a thing.
Yeah,
they are.
Oh my God, but that's amazing for your client.
So what a blessing. That was a blessing. And
I'm sure moments like that just really make you feel all like
absolutely.
Kinds of gooey.
Right now, Marjorie, I have about 80 clients on my weight loss program. Wow. And each one of them, I'm not even trying to exaggerate here, each one of them are doing well. They're losing like they should. I talk to them every month because we do a follow-up every 4 to 6 weeks. They're all doing well.
On that note, have you personally had anyone with such severe side effects that have had to get taken off of it? Or research-wise, have you heard any stories of someone who just has been on it for too long? Or
I have not heard of too long of it causing something too long. But I have had a patient started within 2 months and had extreme nausea and it had to come off.
And just couldn't handle it.
And just could not handle it at all.
Because that is some of the side effects.
That is a side
but
effect
it's not,
of nausea.
I don't think it's anything that most people are like.
Correct. Because you'll get it I would probably say the first couple of weeks, even that first month. But usually if you're heading into that second month, we need to get off.
Yeah. Mm-hmm. And then piggybacking on that, what are some misconceptions that you've heard about this besides the one that we've already talked about?
Oh, you're going to lose your muscle mass.
Okay.
It just makes me crazy.
Good one.
Yeah. So when we think of muscle mass, we're not talking about a surgery that is literally taking all your adipose fat and now you're like trying to figure out what to do with no, that's not how that works. That is one that just makes me crazy.
Really? People are like, I don't want to get too.
No, you have to implement diet, like a high protein diet, and you have to do, weight training or, just working out anyway, strength training.
Which everybody should be doing anyway.
Exactly.
Do you feel like more older or younger women are on this program?
I have a mix.
A mix?
Yeah, I have as young as 18 and I have my oldest is 72.
Wow.
All across the board.
Touching on birth control, because I do want to talk about that. I don't know if I had mentioned, I've been on birth control for 6 years now. Mm-hmm. What alternatives do you give women as far as a more natural way? Like, can you explain that a little bit? I feel like, I don't know if you've caught on to social media. Right now, a lot of women who are doing natural cycling are doing where they track their cycle, and then there's like phases of it. Like you have your lunar phase.
I know.
And then you take your temperature every morning.
Oh, God.
Wait, do you know about that?
I've heard of it.
Okay, what are your thoughts?
So, social media, we love you.
And then also, what are your thoughts? Is that accurate? I have so many questions.
It is.
Okay.
No, it is. That's a thing.
Okay, and then what are your thoughts on someone who is like, I don't want anything in my body, right? I want to get off birth control, but also the medication that I might take with you for weight loss is like Western medicine. I know this is a loaded question.
It is, but it's okay. It's okay.
But I have questions in me needs to know.
So natural cycles, I want to say, just came about, in the last 2 years.
I know.
Because I've been hearing about it.
I know.
Right?
And now it's popping.
Because I tell you, I see all ages across the board. Birth control comes up quite often. Okay. So I usually try to get more of what they want and then kind of say, okay, this is how I can help you. I can help you with this. So natural cycles, you really have to be so in tune with your cycle, just the cycle.
Yeah.
And that in and of itself can be a little confusing for some clients because they don't know when they're in the luteal phase and they don't know when they're ovulating.
What are the phases?
Oh, God, here we go.
Please tell me.
Okay, so you have the luteal phase, right? And this is going to get really complicated for you, and it's going to really confuse. I don't want to confuse your. So this is what I usually tell my patients.
My method is more
ovulatory phase.
I track my cycle. Mine is a little bit more like woo, right? But woo.
We're winging it? Is that what you're doing?
We're winging it. Listen, I don't know if I can say.
No, listen.
That's all I'm going to say. That's all I'm going to say.
That's what I'm saying.
But I want to invest in an Oura ring, which, oh no, it's vibrating.
Why do you want to? I'm just going to question you now.
So
tell me.
Because, the Oura ring takes your temperature and it tracks your cycle more in depth.
Okay, so let me ask you, do you know how often your period comes? Like how, is it every 25 days, every 28 days?
28 days.
Every 28 days.
4 days of my period.
4 days of your period. So that's why I couldn't go into the luteal phase because it gets really, really confusing when you talk about that because everybody's cycle's different.
Okay.
Normal range is usually every 25 to 28 days, right? When you go out of the 28 days, it's kind of like 30 and then 40. And then we're like, okay, something's off. So you're not ovulating at a certain time and your luteal phase is not where it should be.
I had a friend who didn't get her period for 3 years with no birth control.
See, so,
so
there's some hormonal issues going on there, right? So we really have to...
She already booked her appointment.
Yeah.
You're good. You're good.
So you really have to know how you cycle. That's the first thing I like to ask a lot of my patients when they say, oh, I'm going to do natural cycles and I'm going to do the ring. And I'm like, okay, but do you really know how your body, because you have to track that for a good while to know
before
exactly, because you kind of have to put that it's an input information.
But you still encourage it, or do you feel like what's the way to do it then?
Listen, I am always for my clients.
Okay.
I am.
What a political answer, Kelly. I thought we weren't holding back.
No. Listen, but I will give them. I will be very transparent, and I will either say that doesn't work. Let's try something else. But if they are like
set on it.
Yes. I'm like, okay.
Which some of the girlies are.
I know some of the girlies are, and I leave them to be. Listen.
Stay in your Delulu.
Yeah, I will just leave you where you are. But the thing is, they'll circle back around.
Yeah,
and they're like, you know what? That didn't work. And then we will really talk about what helps and what works. Now, natural cycle, that's a thing, right? So I have some patients that'll come to me and say, I don't want birth control pills. I don't want hormones. I tried natural cycles. That didn't work. I was doing plan B. And I'm like, okay, plan B is not a contraceptive.
Wow. Like on the reg?
Yes.
Like on the regular?
Yes.
Isn't that expensive?
Know how many girlies I had, they were like, oh, I took like 4 plan Bs. I'm like, okay, time out. Stop.
My God.
Stop, please. Let's get this under control. Yes.
The side effects that has on your body, holy moly.
Your whole cycles off, right? So then you're not even sure what the next month is. And then
like, who even am I at this point? No, really.
So there's a lot of education involved in birth control. But we can go on and on about that. Again, it's non-hormonal. I don't care if it's a hormone. I just don't want to take a pill. I try to patch, put something in my arm. It's just
very the range is big. Okay.
Yes. Yep.
So I'm coming to you and I don't take birth control. What would you suggest?
Oh, Marjorie.
But I don't want to get pregnant.
But you don't want to get pregnant.
No, not yet.
So
but
let
eventually.
me tell you what
aside
I would
from the
suggest.
weight, right?
So I am pro IUD.
Wow. Okay.
And the reason why is you have less side effects. You have an IUD that's non-hormonal, which is called Paragard.
Okay.
And then you have Mirena, which is a very small amount secreted to your uterus that I like. Kyleena and Mirena are about the same, just lower in hormones. That's what I usually suggest first.
Okay.
For patients who are telling me, I don't want to take a pill. I don't want to take a birth control pill.
How long is that?
So the Mirena could be left in for 8 years. Wow. Pull out when you want. Kyleena is 5 years, and Paragard is 10 years.
Wow.
And the reason why is because I
want to see the other end of it. Like I respect that,
Those work.
Yeah. And I know they do. And there's people who are just being responsible. They just really don't want to get pregnant. Mm-hmm. And I get that, know.
It's in, out of sight, out of mind. You don't have to remember anything. It keeps your uterus healthy because there's a little bit of a progesterone to the uterus. So that is what I usually will lead with.
I think the whole having something inside of me.
I've heard that too.
I'm sure you've heard of it.
That too.
How do you feel about men getting a
vasectomy?
Yes.
Yes, girl. I am for vasectomies first.
Okay.
However, you tell me what man is going to be like, I'm going to go get a vasectomy. They're not forthcoming and they don't want to do it. It's like, no.
It's like, cut. Okay.
So that is hard for men.
Some do. Some who have had 3 kids and they're in a new relationship and they're like,
they're like,
this
is what's gonna happen. But that's not something that I get a lot of from my ladies. They're like, I talked to my partner, they don't want to do it, and I'm like, okay.
If that was an option, is that something that you also provide, or
I don't provide that, but I can refer.
Amazing.
Men to a provider that will do it for them. Yes.
Good to know.
Yes.
Ladies.
Oh my God, yes.
Good to know.
Yes.
Okay. Now, my mom and I have discussed this, is what is it called? Low libido.
Low libido
Low
is
libido,
a thing.
yes.
Not just in older ladies.
Okay.
Let's clear that up.
Let's clear that up.
Yeah.
Exposing ourselves. I feel like I've experienced it at some point. I mean, I'm in my 30s.
I have both women.
And it takes a little bit more work to get the downtown
going again.
Yes. So
it's real.
Let's talk about that. Do you feel like it
there.
happens more common than what people talked about? Really? Yes. Okay, so not just on the
I have as young as like 20s coming to me. And 20s is like, we're rabbits at 20, right? Sorry.
No, he's good. Do you think this is a psychological thing? Is it our bodies?
I think it's psychological. I think it has to do with our hormones as well and how they're all imbalanced. And
I need to have a sex therapist on another episode to just corroborate on this. Is this?
I don't want it. I mentally I just block out.
Right.
And those are the patients I send for more counseling and therapy to help them.
Yeah.
They want to, but they just can't get past whatever block is in the way.
Now, for this specific topic, I know that is it pellets, or what is that?
Pellets.
Hormone pellets. So what's the audience for that treatment?
Now, that audience can be 30s all the way up into 60s, 70s.
And what exactly does that do? Tell me a little bit about that.
So the pellets, it's a hormone, right? So you have estrogen, progesterone, and testosterone. Those are the three hormones that mainly women kind of want to keep balanced, right? So the pellet's like a size of a rice that's injected underneath your skin, kind of on the backside. And it's dosed kind of to what you need. So sometimes patients will have either testosterone and estrogen in there or progesterone and testosterone. Just kind of depends on how they present it. And that's a procedure that's done underneath the skin. And
It's can leave that you do?
I don't.
You don't? Okay.
I was actually thinking about it, but I have mixed reviews on it. I'm going to tell you why.
Okay.
Once it's left in there for 3 to 4 months. Okay. What I found, and I would probably say 50% of my patients will come to me and say, I've done pellets for a while, but I didn't get anything from it, or I was too extreme, and they had to kind of wait that 4 months for that medication to kind of subside, and then they go and get another one.
Too extreme as far as their sex drive in particular,
mood changes.
Gotcha.
So again, you have to be very careful with the hormones. It's a fine balance. Like too much testosterone, you're like Hulk,
right?
Why
is my wife acting like that? Oh.
Yes, it's like...
What about hair, too?
Yes, wow. So you have to be careful of not dosing it too high. You have to have that right amount to get them where they have libido and energy.
Okay. So what do you offer to aid someone who is struggling with this, or maybe someone who's a little bit older and is just... struggling with this?
So I offer hormone replacement therapy.
Okay.
I either do pills, under the tongue troches, patches, and creams.
So it's the same as the pellets,
it's
but distributed different.
Yes,
okay.
Exactly.
So you do offer it.
I do. I just don't offer the hormone pellets.
Okay. So what are the other ones you said? Pills.
Troche is kind of under the tongue where you just kind of let it dissolve.
Good to know.
Yeah.
I'm gonna let my mom know.
Sorry, Mom. Send her my way.
No, I mean, she
listen.
I'm
saving marriages.
Yeah, it happens.
Quality of life
and
is
I
back.
think it needs to be talked about too.
Yeah, that's another thing that's not quite talked about because it kind of goes into perimenopause, which kind of happens sooner than we like. A lot of women don't even know perimenopause exists. We all know menopause, right?
What does perimenopause mean?
So perimenopause is before menopause. You're having all of the symptoms before menopause actually hits, right? So again, we think of menopause, I'm too young for menopause. That happens when I'm in my 50s and 60s. No, not really. Perimenopause comes before menopause. And a lot of women in their 30s, mid-30s, late 30s, early 40s, mid-40s can experience perimenopausal symptoms, which is mood changes, brain fog, little night sweat.
Yeah. And I think that's the biggest thing that they struggle with is those symptoms.
And they don't really know what's going on with their body because they're like, no, I'm not in menopause. Because again, we're thinking about the latter years of menopause.
Is there a post-menopause?
Yes, there is postmenopause.
Oh my goodness.
You're just done. You're out of it. You're just like,
Oh, beauty.
yeah. However, there is something called vaginal dryness that kind of happens around that time.
Now, the treatment will help with that?
Yes.
Okay.
Yes. There's even local treatment for vaginal dryness that you can apply right into the vagina.
There's how does that connect with pelvic floor exercises?
Something totally different, but
Really?
helpful.
Okay.
Very helpful. I've had to actually refer quite a few of my patients out for pelvic floor therapy. And this is all related to, again, kind of in the latter years of like incontinence.
Okay.
I don't know if you like any of your clients even talk to you about
A little
that.
bit.
A little
yeah.
bit. I mean, that's something that's a little embarrassing, and I get that.
Yeah.
That can be very embarrassing to talk about. When I see my patients and I'm down there doing an exam, I'll ask, how's your sex life? Are you having any pain? Are you having any leakage with urine when you cough, sneeze, or laugh? And then they'll start to open up and let you know, by the way, I am. Pelvic floor therapy can definitely help with that. It can really...
So it's not connected to dryness, more as far as like comfort.
Exactly.
Like
over time, the vagina does not get the estrogen that it needs in the vagina.
It's a muscle, right?
It's a muscle,
And
but it's also tissue
Yeah.
that needs to stay nice and supple. If not, it becomes sandpaper.
Right.
Over time.
Okay.
Another thing I like to talk about is I have a lot of my girlies in their 30s that do weightlifting.
Ooh.
Heavy weightlifting.
Yeah.
And they don't really know that they're really trying to tone the core, and I get that, but they don't realize that the pelvic floor takes a hit too. It weakens it a little more, just if you're not doing it correctly.
Right.
So I like to educate my young ladies on how they're weightlifting and making sure they're keeping that intact.
What would be some signs that someone could tell the difference between being a little bit dry as opposed to like having to do pelvic floor exercises?
So the
like
pelvic floor
pain?
exercises is they can't hold their urine like they did before.
Oh, wow.
It's almost like they gotta go, and it's like you're in your 30s. Haven't had a child yet because
I have a friend that sneezes and she pees a little. So
does she do weightlifting?
No.
No. Okay. Has she had children? Because that's a big part of it as well.
No.
You got some big babies coming out of there. It's gonna bring those make
Right.
those muscles a little weaker than usual. But pelvic floor therapy may help your friend for sure. The earlier, the better. Vaginal dryness. Now, this is the thing we do, or we may, as younger women, have a little bit of vaginal dryness a week or two before our periods because all of our hormones are kind of in the toilet getting ready for our period. So we don't have anything that's keeping the vagina moist. Our moods are probably off. It's the PMS symptoms that you experience sometimes. And then you're back to rolling again. You're good. It's good.
Rolling. Literally. Oh, good to know. Do you also have like you were able to refer someone to do pelvic floor exercises?
Yes, I do recommend pelvic floor therapy. Actually, who I usually use is Share Pelvic Health in Maitland.
Okay.
And that's who I refer majority of my patients to.
Amazing. Good to know, Kellie.
Yes.
Thank you for sharing that with me.
Of course.
This has honestly been so enlightening, and I hope that this episode helps someone out there, anyone out there, because it certainly has taught me a lot, and it's cleared up some misconceptions and some things that I just had no information about,
I think we should be having a conversation.
Absolutely. Now, I want to do a hot take question with you just to kind of end the podcast on a good note.
All right, let's do it.
Thin brows or thick brows?
Thick.
Thick?
All day.
All day, every day?
Yes. And twice on Sunday.
I love it. Okay, and lastly, I like to do a rapid fire question section with my guests. So, what comes to mind? Just go ahead and say it.
Okay.
Coffee or tea?
Coffee.
Cats or dogs?
Dogs.
Sweet or savory?
Savory.
Sneakers or sandals?
Sandals.
Okay. And what is one piece of advice that you received that has stuck with you until today?
Oh man, I've had a lot of that. The most. You said the best.
Yeah, like one piece of advice that has really marked you, that has, I would say, maybe either changed the trajectory of your life or really moved you to where you still hold on to today?
Oh, stay authentic, always.
I love that. Who said that to you? Can we?
So it was my mentor.
Amazing.
My mentor, she's been with me for, I want to say 20 years. And every time I talked to her, she said, you just stay your authentic self and everything else will come.
Amazing.
Yes.
Now, lastly, tell everybody where you're located. I know that you have some big changes going on now. What's happening?
What's happening? Okay. So currently I have Women's Health 360. I'm currently located in Belle Isle. That's 20 minutes south of downtown. I've been there going on about 2 years. So June, I will be moving to Lake Nona in the Dr. Phillips Specialty Pharmacy in Lake Nona, 5 minutes from my house. And I'm so excited about
girl, that traffic. Good for you.
Yes. And you can catch me, or you can log onto my website, health360women.com, schedule an appointment, and I'll be glad to help you.
Yay. Awesome. Well, thank you so much for being here, Kellie. I love this conversation.
Thank you for having me, Marjorie.
Oh my God, you're amazing.
You're amazing.
Oh, thank you. You guys, be sure to check out Kellie Williams at Women's Health 360. She has amazing services. You heard it here today. And honestly, if you guys have any questions, reach out to me. I've known Kellie for a while now, and she's doing some amazing things. And I know I have a lot of clients in Lake Nona who are going to be really happy about this move. So thanks again for being here.